Hello and welcome to the Children's Safety Network webinar on preventing adolescent dating abuse, research, and practice. This is Jenny Stern-Carasone from the Children's Safety Network. We're very glad to have you all joining us today. As of 2013, 1 in 10 adolescents reported being hit or physically hurt on purpose by a boyfriend or girlfriend at least once in the previous year, making adolescent dating abuse a very urgent injury issue and increasing the need to understand what we can do to prevent it. In this webinar today, we will be talking about both research and practice to ensure that we have an accurate understanding, first, of what adolescent dating abuse is, and second, so that we are aware of some of the effective strategies that are being used to address it. Before we go on, I want to provide a few technical tips. Audio is streaming through your computer speakers, but please be advised that your audio quality depends on your internet speed. If you find your audio is choppy, you can listen over the phone by dialing in to 866-835-7973. Your phone line will be muted. And if you do listen over your phone, though, we ask that you mute your computer speakers to eliminate any potential echo. Additionally, if you cannot listen over the phone, we suggest that you try getting a better internet connection by plugging into an Ethernet cord rather than using wireless. Also, we are recording this webinar and will send a link to the archived recording to all of those who are registered for the webinar. And you could submit a question at any time using the Q&A box at the bottom left of your screen. We will address your questions during the Q&A portion of the webinar after we've heard from both of the presenters. So now I'd like to move on and spend a moment to introduce our two presenters today. Emily Rothman is an associate professor of the Department of Community Health Sciences at the Boston University School of Public Health. She has secondary appointments at the Boston University School of Medicine in Pediatrics and Emergency Medicine and is a visiting scientist at the Harvard Injury Control Research Center. Her primary area of research expertise is the prevention of adolescent dating abuse, and she also conducts research on commercial sexual exploitation of children, pornography, and community violence. Dr. Rothman has been collaborating with Nicole Daley of the Start Strong initiative at the Boston Public Health Commission on Youth Violence Prevention Evaluation Projects for nearly a decade. Nicole Daley will also be joining us today. She is the program director with the Boston Public Health Commission, where she has been since 2010. Ms. Daley has been working in the field of adolescent dating abuse for 8 years at Start Strong, building healthy teen relationships. Start Strong is an adolescent dating abuse prevention and healthy relationship promotion program based on peer leadership model. During her tenure as director of this program, the youth have conducted yearly breakup summits that advocate for healthy breakups and conduct healthy relationship promotion workshops throughout the city of Boston. I'd like to now turn this over to Dr. Rothman to begin our presentation.
Well, hi everybody. This is Emily Rothman, and I'm so happy to be able to talk to you about dating abuse today, and I'm looking forward to your interest and your questions as well. So we're going to start off today with a poll. I'm just sort of curious how many people here have some prior experience talking with an adolescent, either through work or in your personal life, about dating abuse. So it looks like so far over 2/3 of the people have had some experience. We've got around 17% saying, you know, sort of, and see if the numbers are going to climb. Got a lot of people on this call today, so yeah, so it's looking like about 2/3 of people are saying that they've had some experience at some point talking with an adolescent about dating abuse. Okay, so I'll probably move forward from there and say that's great. I am so glad that a lot of you have had the experience of talking with a youth about dating abuse, or maybe I'm sorry if the reason that you had to talk to them had to do with their victimization or perpetration. But I will tell you this. We did a study a few years ago to find out what proportion of U.S. parents have ever had a conversation with their adolescent children about dating abuse. And it was a smaller percentage than among you all, maybe unsurprisingly. But 50% said that they had ever talked to their children about dating abuse. And they also, the same sample said 91% of them had talked about drugs, 82% had talked about alcohol, 75% had to talk about sex. So it just, people are willing to take on these important topics with their children, but maybe not quite aware of how important it is to talk about dating abuse as well as those other topics that parents are usually advised to talk with their kids about. So I'm on a bit of a mission to get people to think about this topic not as teen dating violence. Teen dating violence is kind of the old term that we used to use to talk about this. But I'm going to try to make a case here that it should actually be called adolescent dating abuse. And part of the, well, as you all, I'm guessing a lot of people here probably know, when we're talking about adolescence, we're talking about this period of time that spans from as early as 10 years old all the way through 25 years old, emerging adults. So, there's plasticity in our brains, and we're still maturing and developing all the way through age 25. Meanwhile, I have a 10-year-old in my house, my daughter, and I can tell you as early as 10 years old from my own firsthand experience that normal trying to differentiate, individualism, a little bit of sensation seeking, all of that stuff starts happening for youth as early as 10, 11, 12 years old. So, for that reason, I'm trying to promote this idea that we should move away from the word teen. And also, when it comes to violence, violence for most people really only refers to sexual or physical acts of abuse. And we're also trying to include emotional abuse and other forms of coercion. So widening it out by talking about adolescent dating abuse, I think, is a helpful way to think about the concept. So that's how I'm going to be referring to it today. So this may come as a surprise, but about 20% of North American youth start dating at 10 to 12 years old. The average is about 14 years old. If you're 17, 18 when you start dating, you're what they call at the American Academy of Pediatrics a late bloomer. And unfortunately, what this also means is that 13 to 21% of middle school students report that they've ever used physical violence against a dating partner. And that's across a number of different studies. You can see in that I put four different studies that have all found the same thing. This is a major concern. Let's take a minute to stare at these youth risk behavior survey data. So maybe a lot of people on this call are already familiar with the youth risk behavior survey, but this is nationally representative of U.S. youth who are high school attending. And it used to only have a question about physical dating violence victimization on it. It now has two separate questions, one on being physically hurt on purpose, and a second question about being forced to do sexual things that you don't want to do. So in 2013, 11% of all respondents said that they'd been physically hurt on purpose. And when we break that out by female versus male, it was more females than male, a higher proportion said that they'd experienced physical violence. So in terms of sexual violence, it was also 11% and roughly the same, 14% of females as compared to 6% of males that had this experience. When you do the calculation, have you experienced either physical violence or sexual violence? 17% of U.S. high school students said that this had happened to them in the past year, and females were twice as likely to have had the experience when you widen it out to include either physical or sexual violence. So for the data geeks who are sitting there trying to work out the math about well then what proportion reported both or how does that, so I'm not going to spend a lot of time on this, but roughly a third of males and females had both experiences. So what does this mean? If 17% of U.S. high school youth are reporting that they've experienced sexual or physical dating abuse in the past year, that means that this issue is on par in terms of prevalence with many of the other adolescent health behaviors and conditions that we try to focus on as some of the most important and major issues. So whether it's marijuana use, considering suicide, obesity gets a lot of resources and attention directed towards it. In comparison, dating abuse prevention and intervention receives relatively less. There's less research funding support. There's less sometimes information for parents or for other people, and less funding and resources available for people at schools or in communities who want to help. I also wanted to point out this is from a slightly different data source, from the AdHealth data source, the National Longitudinal Survey of Youth. And gay and lesbian youth experience dating violence at least equivalent rates to students in opposite sex relationships. So there's some, among adults, there's an indication that people who are bisexual may be at even increased risk for dating violence victimization. But, these data don't support that, but that they do show that they're at least as likely to be victimized as those in the opposite sex relationships. There's a number of sequelae of dating abuse, victimization that have been documented through longitudinal research. So, of course, you worry when somebody is abused that there's that injury that can happen in the moment, tragically even death. But there's other behavioral things that can happen as well. So people who are victimized can become aggressive themselves. They can experience, they're at increased risk for subsequent victimization in a different relationship. They may experience anxiety or depression, post-traumatic stress disorder, disordered eating, suicide and self-harm, ideation, drug and alcohol use, and things can get difficult at school. I wouldn't want anyone to panic, because just if you know a young person who's experienced dating abuse, it's not a foregone conclusion that they're going to experience any of these things, but they are at increased risk, and so it's a reason why making sure that we intervene and do what we can to support and help early is really important. A lot of people ask me, why would anyone do this? Why does dating abuse happen? Why would someone perpetrate intimate partner violence? That's what the IPV stands for. And I teach a class about domestic violence at Boston University, and we go over 14 different theories in that class about why people might perpetrate partner violence. I'm not going to go into all of those here. I'll say that I am personally, I tend to favor the background situational model, but I'm going to summarize for you and say, basically, there are factors at all of these different levels of what we call the social ecological model, right? So at the individual level, there may be factors related to an individual's psychology or even biology. So some kind of frontal lobe injury to the brain can increase aggressivity, or they may have trait hostility, like a certain psychological trait that may increase the likelihood of perpetration. There are family factors like witnessing interparental violence or experiencing child maltreatment, hanging out with a delinquent peer group. It tends to elevate risk for violence perpetration and dating abuse perpetration specifically. Being in a community characterized by higher rates of violence or where there's lower collective efficacy can increase risk for dating abuse perpetration. Institutional factors would be things like going to a school where there are policies about dating abuse. That can really impact whether or not people are more likely to perpetrate dating abuse. So institutional factors like guidelines and policies and whether staff is trained, that can make a difference. Societal factors, and people have done studies that in societies where there's sort of gender norms can be related to dating abuse perpetration, or the acceptance of the use of violence as a way to solve conflict. These things can also predict the level of partner violence in that society. So what I like to stand back and then sort of focus on after reviewing those risk factors is that we have different ways of, therefore solving these problems. We can come at it from the individual psychology perspective, where we got to get kids diagnosed and treated if they start showing signs of having problems early on, make sure that people's families of origin are healthy, make sure that there are pro-social opportunities for kids in their communities in terms of jobs, and also that they get mentorship from people that they look up to and respect in terms of relationships. And that in general our society is doing everything that it can to promote a culture of respect and nonviolence. So let me talk to you for just a couple minutes about dating. So this is a picture of courtship from the 1800s, and so how did courtship happen in the 1800s? It depends on the country and the society and the socioeconomic strata, but for one particular group of people there was this thing about bringing a calling card, or they had their particular rituals, and courtship looked a particular way. That is not how it looked years later. So for example, if you were white and middle class in the 1950s in the United States, dating looked a particular way. You hear stories or you see movies, or maybe you experienced it, where people would date several different people, and then if one person stood out, they would get pinned, or they would wear that person's leather jacket, and that's how you knew you were in a special relationship. So that's not how people were dating in the 1980s and the 1990s. And it isn't how they're dating today. So for people who haven't seen it, this is like a screenshot of the app called Tinder. Tinder is not a dating app. It's basically a sex hookup app. But you sort of flip through, or you scroll through, and you're matched with people, and the idea is that you're going to get together potentially right away. So what that means for me is that when we're talking about adolescent dating abuse, it's possible that we're a little bit out of touch or out of date with what it means to be dating. I mean, I think if you walk into a room full of adolescents today and you say, if the boy pays for the date, he doesn't have a right automatically to expect sex, you tend to get some blank looks. Like, that resonates for youth less than if you start the conversation talking about, do you know anyone who's ever been asked to send a naked selfie to somebody else in their class? And then the room sort of lights up and the kids all want to start talking. Because, the experience of what they say, some of them say, like, I was talking with him, or I'm spending time with someone. So that may be more relevant for them. The way that they are getting together and the way that relationships are configured and what actually happens in those relationships is sort of changing. And as a field, it's on us in dating abuse to try to catch up a little bit with how the courtship rituals and what people are actually doing, and making sure that we're measuring things right and that we're really getting at the right issues in order to be able to address it. Unfortunately, this is just from Urban Dictionary, and that's not representative of everybody, but these got a lot of upward votes or thumbs up. People really don't think a lot about, think highly of dating necessarily anymore, and I apologize for the rough language on these slides, but this is what kids see, this is what adolescents see, and in many cases this is how they're talking about dating. And so it's maybe important for us all to shift a little bit in terms of our measurement, in terms of what we're doing in some of our prevention and intervention work. So let me stop and ask you this. Is this presentation making you think about the young people in your life starting to date and making you panic? And if so, I'm really sorry, because that's not at all my intention. As I said, I'm a mom myself. I've got 2 daughters, and so this is all stuff that I think about for work. And also for the young people that I know in my life personally. Okay, good. So it sounds like either everybody, more than half of you are saying you're aware of these risks, or a lot of this isn't really news to you, or at least you're calm people and you're not panicking more than you were. And for the quarter of you or so who are feeling a little nervous, we'll see what we can do to try to reassure you that there are prevention and intervention efforts out there that can make a difference. So I'm going to spend my last minute here, or a few minutes, talking to you about one research project that I'm working on. It's funded by the National Institute of Justice, and it's a randomized control trial in a hospital setting where we take kids who are between 15 and 19 years old, and if they tell us that they've perpetrated, we use a survey, but if they endorse any of the items that tell us that they have perpetrated an act of physical or sexual dating abuse in the past 6 months, then they are eligible for this trial. And we do, well, I'll say first that why are we doing this hospital-based perpetrator intervention study? And we're doing it because prevention programs in schools, we know, can be very hard to implement. They're very hard to get off the ground, and sometimes they're not always effective because they can be implemented very differently in different places. And the other reason is that there's a lot of focus on victimization already, and we wanted to do something about perpetration. The other thing is that if you haven't heard of brief intervention or motivational interviewing, worth Googling. Motivational interviewing is a style of talking to somebody that can really elicit behavior change in terms of alcohol use, marijuana use. And so we were thinking, how can we harness the power of brief intervention and motivational interviewing to make a difference in dating abuse? Proud to say that I do get some advice from the Start Strong youth that Nicole is responsible for sort of organizing and supervising. And that's actually been a really important part of my work, is to have the direct input from the kids that this intervention is meant to serve. It's primarily Black and Hispanic youth who are living in Boston. So what do we do in the intervention? We try to build a rapport. It's about a 30 to 45 minute conversation, basically. We try to build a one-on-one rapport with the youth and engage them in a bit of a conversation about their dating relationship. We give them feedback about what it sounds like is happening in that relationship. We don't go in depth into the details or specifics of any particular conflict that they may have had, but we try to give them feedback that helps them understand whether their behavior is normative compared to other adolescents, and whether they might want to think about figuring out how to cut back and stop that abusive behavior, the unhealthy behavior that we don't want happening. We go over the pros and cons of behavior change with them, and then any barriers that they might see to behaving in a healthier way. I'm a sort of believer in behavioral economics, and so one of the facets of this intervention is that we don't try to convince them to have more empathy for the victim. That's not part of this intervention. We don't say put yourself in her shoes or anything like that. We talk about why perpetration might be bad for you. You could injure yourself or your partner, which could then mean you have to go to the doctor or something happens. There could be police involved. That could be bad for you in the long run. It can increase stress. So we try to convince people that there's really something in it for them making a behavior change. And it's because we only have that 30 to 45 minutes with them. Feel like that's too short to really increase empathy. So we're using what we have to work with. I have just 2 minutes left here. We do also give tips. We walk through with them what are some things that you could do when a conflict comes up in your relationship that would mean that you're not in any danger of hitting or hurting somebody. So we go through these like 13. We have a few others that we also have over time added to this list, but these are the main ones that we talk about. And we do have preliminary results that are in print already that suggest that this intervention is promising. We will have the results from the larger trial forthcoming, so stay tuned for those. But please feel free to get in touch with me, and I warmly invite you to follow me on Twitter, where I post the results of my research when it becomes available. So that's one way to get them. So Thank you very much for your interest in this topic and also your attention. I'm happy to turn things over to Nicole now, and we'll stick around for questions too.
Hi. I'm excited to be here as well. As Emily mentioned, we have done a lot of work together in the Boston area. So it's exciting to share the work that we've done and kind of our lessons learned from the work that we do here in Boston, and particularly with our peer leaders. So a lot of this presentation that I'm going to do is going to center around the work that we do with our peer leaders, the changes that we've seen, and then how we've prepared them to be change agents in doing this work alongside us. But before I start, I wanted to just do a quick poll just to kind of see where folks in the audience are working. So are you working mostly with middle school aged youth? Are you working with high school aged youth? If you're doing work with both, just to kind of get that sense. So I see that the majority are doing work with both. So that's definitely heartening to see. I see a fair number are working mostly with high school age youth. And then hopefully after this call, the ones who are not currently working with youth but hope to do so in the future might have some things to take away and kind of tips to follow up with. And as always, after the call, especially if anyone wants to reach out directly, we're more than happy to talk about the work we do on a one-on-one basis. So it's exciting. Almost 200 people are working with both age groups. Especially when we started this work a number of years ago, that wasn't necessarily the case. So this is exciting. So I think we can continue with the presentation. Thank you. It's good to get a sense of the room. So who we are. So Emily alluded to us. We are Start Strong. We were originally funded by the Robert Wood Johnson Foundation, and so that was the first initiative that was really looking at how to go younger in terms of who our audience was when we were talking about teen dating violence. So roughly, a decade ago, we're closing in on a decade when we started this work. People were traditionally talking with high school age youth about relationships and dating because the premise was that middle schoolers, that was too early, they weren't necessarily dating, and so the modus was to think about going later. But with the initiative, we were really charged with thinking about primary prevention and how to go younger. So a lot of the work that we do is with middle school students around the city of Boston. But in doing that work, we have developed the peer leadership model. So we train high school age peer leaders to do the work alongside the staff of our program, and actually to really take the lead, and as staff we're supporting their work out in the community. So our focus is on healthy relationship promotion, and when we say teen dating violence, we really say it in the broadest sense of the word. So that slide that Emily alluded to, with all the different types of relationships, we are inclusive of all of those because we recognize that dating looks very different for young people. So it includes friends with benefits, it includes talking. So we really allow the young people to frame their definition of dating when we go into these conversations, and we make sure they know that it's all inclusive. And then one of the things we started doing at the start of the program, we just had our 7th annual summit, was really around breakups because we felt that it was an area that wasn't often discussed in detail. And we really wanted to highlight that, especially when we think about primary prevention, because we know that the most dangerous time for a victim is when they're leaving their partner. So if we're thinking about what primary prevention should look like, it's like, how do we get the broader message out that everyone should have a healthy breakup? These are what healthy breakups look like. These are the things that are included in a healthy breakup. And then the last piece is media literacy. So we really highlight and think about young people as consumers of media, but then also thinking about them as generators of media. So we do it from both lenses. And as later in the presentation, I'll share more in detail what our media literacy program looks like. So we also are based on the social ecological model, and so we're not just doing classes in schools and community centers and out-of-school time programs. We're really thinking about how that message goes all the way up in the community. So we have a number of different projects one or two projects that we do that really is just a tool that we give to the broader community so that parents can be talking with their young people. We're thinking about how do we engage legislators as well, and thinking about teen dating violence. How do we work with our schools and with the entire Boston public school system in thinking about this. So we're trying to think about all the different layers, and what we like to do is think about the middle school student in the center of that, and the high school student in the center of it, and then all these layers encapsulating them, and how do we touch each of these layers that ultimately impact them. So just kind of a sense, we've trained 80 peer leaders to date. We've trained over 13,000, and that's a higher number, of middle school and high school students, because we're really trying to service the entire city of Boston. And then we also do a number of trainings for adults as well, because we know that we're still limited in our capacity. We're only one program. So how do we increase adults' capacity to have these conversations about dating violence and healthy relationships? So one of the things we do in detail, you're wondering about our high school peer leaders, is we start with a 6-week summer peer leadership training program. So that's where we get the very basic foundation, where we start to unpack the social norms that they hold around relationships. We start to have the initial conversations around media literacy. We begin to have conversations around trauma and what trauma looks like in the lives of a young person, not just around exposure to domestic violence, but community gun violence, and thinking about all the many layers and ways that dating violence can intersect with their other experiences. And then we have it continue. So again, these are very, very entrenched social norms, so it takes longer to unpack some of them. And so during the school year is when they go out to community centers and after school programs, and they start to train their middle school peers and their high school peers as well, but then they're also still coming back to us to continue their own training, their own understanding of what these norms mean, or what the messaging in the music and the movies they're consuming, what those mean, and continuing to have those discussions. I think what's really important with our program is we've given them concrete opportunities to serve their community. So we don't treat them as clients. We're really thinking about them as young leaders that are out there in the community. And then another piece is that it's not an annual program, because I know some programs, when they're viewing young people as clients, but not as youth leaders, it's usually like, at the end of the school year, then it's over, and then you get a new cohort, and you start over. But really, we encourage and have a high we have a high continuation rate with our young people. So any given time, we have over 50% are returners, and then we have 40% who are coming to us new and getting folded into the program. And then we are very much based on the youth development model, when we're thinking about how do we train these young leaders to really take the helm when we're talking about dismantling teen dating violence in their communities, where they are locally, within their families, within their school days and their school communities. And so I just wanted to highlight this picture, because a lot of times it's just one of the principles of youth development, is that when we're inviting young people to the table to join our organizations to do this work, we often don't think about the table and how the table is set that we're inviting them to. And we just I always like to highlight that it's really important to think about the nuts and bolts of it, just as much as the content and what staff want to teach the young people. So what time is the program meeting? If you're working on a project, so a social media campaign for your town, or if you're thinking about kind of rolling out a new event for a school, like how are you inviting the young people to be a part of designing that initiative for the school community? And then I think it's important to share about also building skills. So with our peer leaders, again, many of them are returners, and because we know we're skill building with them, that it's really important to take that time to talk about, public speaking, to talk about the content that they're learning, because violence prevention is so tricky because it's nuanced. It's not like smoking cessation, where there's certain very concrete behaviors that will usually have like a very specific outcome. This one is still based on another person's response to how they're engaging with them. So I think it can be very complicated. So it's a lot of skill building with them, a lot of skill building on how do you share the message. It's a lot of skill building in how they're acting in their everyday lives, and how they're engaging in their relationships, and really kind of teasing all of that out. And so it does definitely take time. So we encourage any programs or anyone who wants to adopt this model to really be thinking longitudinally, and thinking about the young people over the course of a year, over the course of 2 years as they're doing this program. One of the things that we learned really quickly was around social media. We all know it's here to stay. We actually don't think of it as purely negative at Start Strong. We think of it as something that is a tool that can be used for positive or for negative. And so we jokingly talk about just the world of selfies. I literally, if I see another teen take a selfie, it will not be too soon because it's just ingrained in them. They're digital natives. They are the generation that grew up always having been engaged in social media. And so when we talk about it, all of the pieces are like, how does dating violence look offline and how does it look online? And we constantly bounce back and forth between the two and think about that integration when we talk about the 5 types of abuse. So what does that look like online and what does that look like when they're in their schools and in their communities? So media literacy, for us, we have partnered, we're fortunate, and one of the takeaways if you're thinking about programs is if you're fortunate to have a university or which we're very fortunate in Boston, have many universities that we can tap into, connecting with them and kind of seeing their resources, because we have been able to connect with Emerson College and also with MIT to use their resources and their space to think about our media literacy program. So we borrow the cameras from them. We work with their staff and with their professors, and we really have thought about like how do we teach the young people to unpack the messaging that they're consuming, but also how do we also support them in creating messaging and putting things online, because when we think about media in this day and age, before it was very centralized around the bigger media giants, but now really anyone can be a media producer, and so we want them to think constructively about it and think about how they can spread that message. And so over the course of the 6 weeks during the summer, we do this partnership in order to help them start to build that skill. And so again, we're teaching the young people, and we cover topics like healthy relationships, teen dating violence. We talk about sexual health, substance abuse, because all of those are interwoven when we think about the intersection of risk factors for teen dating violence. One other piece we've done that we specifically have also done to continue the conversation around media literacy is then how do we talk with folks outside of our program? How do we talk with the middle school students when we're doing workshops, when we are out in out-of-school time programs at the local community centers? And so we've developed, in conjunction with our peer leaders together, media literacy tools that just kind of support that conversation. And so this tool actually is a second-generation tool, but really came out when about 8 years ago the Academy of American Pediatrics came out with a statement paper where they did a meta-analysis of a number of papers that were connecting music and health outcomes. And so that paper basically did not establish causality, which is extremely difficult to do, but it did say that there are correlations. After looking at the broad data, there's correlations between the types of music that people listen to and their health outcomes. And so we said, what do we do with this? I mean, clearly young people are constantly plugged in. They're connected to their phones. They're connected to the current music. And so how do we have that conversation? So it's hard to see, but what you find is that we talked about what are healthy music ingredients, and then our healthy relationship ingredients, and what are unhealthy relationship ingredients. And so basically again, this one is more about the visual videos that they're seeing, but we also have a tool that also connects with the song lyrics that young people are listening to. And so we just have them kind of listen to a song or watch a music video, and they will just kind of tick off, well, how much drama do you think is in this song? How much possession or obsession is in this song? And so we basically had them evaluate, because again, the developmental arc where the young people are, telling them not to listen to certain music is not going to be productive, but engaging them in a conversation about the music or the video or the music that they're music video that they're watching will be more productive. And so this is just another way to support that conversation. And then another piece that we're, again, when we think about the work that Start Strong does, is we're really unpacking the norms that young people get exposed to around relationships, and one of the pieces is around gender norms. And again, young people are consuming very often movies, they're consuming music videos, they're consuming a lot of visual media that says a lot about gender norms. And so we wanted a tool that would help them to really think about, okay, who is this character? What kind of norms are they putting out there? Are they being overly aggressive? Are they talking about being flirtatious? Are these being also pegged to the gender that they're presenting? So we had this tool called the Real Binary that again supports the conversation around gender in movies and visual media. And then, as I mentioned at the beginning, we also do an annual breakup summit. So we're fortunate enough to have done our 7th breakup summit. And one of the reasons why we did it is because we, many moons ago, when Chris Brown and Rihanna had their incident, we did a lot around that. We had a number of conversations, and we were trying to figure out how to continue to have the conversation around healthy breakups, just kind of thinking about it in a very specific way. And so one of the things we did is we did a focus group before we did our first breakup summit and thinking about what do young people want to see? How do they view a healthy breakup? And then even though we call it a breakup summit, really the summit is about positive conflict resolution. Because if you think about a breakup, it's actually the ultimate conflict, but you still have to figure out a way to resolve it in a way that works. And so we talk about having a face-to-face breakup if and only if you're not afraid of the risk of violence from your ex-partner. But we talk about what does it mean to break up by phone? What does it mean to break up by text message? What does it mean to break up via social media? And we talk about those things over the course of the day to help the young people think about how they want to create boundaries in a breakup, how they actually want to engage in a breakup. Because one of the things we knew at that time is that there's a lot of magazines out there. There are a lot of things that talk about what happens if you are on the recipient end of being broken up with, but really there weren't a lot of conversations, like preparatory conversations, saying, have you thought about how you want to walk into a breakup? How do you actually want to talk to that person? What does it mean? Because breakups are not very definitive. They often are a gray period for that couple as they're figuring it out. And so what we've heard from a lot of our teens is, how often do you talk after the breakup? Do you try to be friends? Do you not try to be friends? There's a lot of nuanced decision-making that happens. What if you go to the same school and you see each other all the time? How are you going to handle those things? Do you, again, the social media piece comes into place. Are you going to delete pictures? Are you going to keep pictures up? Are you going to untag? Are you going to unfriend? There's a number of different conversations that need to happen when we're having a breakup. And so we know how important it is to help young people engage early and often. And then over the years, we just happen to do different themes to kind of keep it fresh and relevant. And again, this is where our young people lead, because they create the workshops, they create the theme, they create the entire day. And so our third one was on cheating. We've done gender and breakups. We've done technology and breakups. We have done this year we did You Do You, because we were talking with our teens, and there's a particularly snarky way of ending relationships where you go online and instead of formally ending it, you just kind of subtweet or you put out sub-messaging and statuses on Facebook, and I don't know if you guys know, but subtweeting is basically when you put out a status which is targeted to a person, but you're not saying that person's name, but somehow you're saying it in a way that the people within your circle know that you're talking about this said person. And so basically you're throwing, I was about to use another term, another colloquial, but you're being snarky towards them. And so they call it subtweeting. And so a lot of these things are happening to precipitate breakups, but there's not a lot of skills in, well, how do I have this conversation? No one's really talking about that part of the relationship, how it's ending. And so my last 2 minutes, because we're wrapping up here, is we also did the Halls web series. And so if you go to www.thehallsboston.com, we had a grant from the Office on Violence Against Women where we were thinking about, well, what do we do as messaging around healthy relationships? How do we want to promote it? The grant was specifically the Engaging Men and Boys grant, and so we were thinking about how do we target and talk with particularly young men, but with all teens around things like identity, trauma, fatherhood, and things and the influences that go into healthy relationships. And so we created a webisode, 8 webisodes, and we chose not to do a traditional PSA because, again, violence prevention is very complicated. It's not something where you can say, do this one thing and this will be the outcome. And so we figured if we created a tool that the field could use to have discussions, to host viewing parties and really engage the young people within their circles, that would be able to help really support having deeper and more meaningful conversations around behavior change or expectations around relationships, and really allow the young people to engage in a deeper dialogue. We're happy to say that we are going to be doing a Halls 2. We're in the middle of production, so we're really excited about that. And really, if you go on it and if you have any questions, there's an accompanying discussion guide because, again, we recognize that we do this work all the time, but that there are other providers in other areas who might do just sexual health work, or they might do substance abuse prevention, but still know how important it is to have these conversations about relationships. So we wanted to provide them that tool as well. So those are kind of the myriad of things that we've done, again, with our young people at the helm. And if anyone has any questions about content or what we do, I'm more than happy to answer them as well. Thank you.
Wonderful. Thank you so much, Nicole and Emily. So I want to turn now to questions. We've received quite a few questions during the course of your presentation. Several of them are clarifying questions, so let me just turn to those briefly. Emily, there was a question when you were presenting the YRBS information, just asking for clarification on the population size of the study.
It was thousands, tens of thousands of people, and I don't have the exact N, but the YRBS is given nationally in all of the states of the U.S. It's administered by the CDC. So these are really stable estimates.
Great. And also there was another question regarding the national surveys as to whether or not there's any effort that you're aware of to change some of the language in the surveys to match the language that you shared with us that students are using and so forth.
Well, it's so funny because I was part of the group of people that campaigned to change the language on the YRBS from what it used to be prior to 2013 to the way that we finally got it to be in 2013. And we felt pretty good about that, and we're probably ready to go at it again. The problem with changing language on a YRBS means that you no longer can study trends over time in the same way. You can only look at, is it increasing, is it decreasing over the decades if you have the wording the same. So there's drawbacks of changing the language too.
Great. And Emily, you shared a lot of information about, some of the warning signs and particularly the Start Strong prevention intervention strategy being utilized. A question came in regarding whether or not there's a sense of the level of life skills such as conflict management, problem solving, communication, and so forth youth have when they're coming into the program, and whether or not this would be predictive of how well young people would do in the program.
So I think that's a question for Nicole, probably about her Start Strong programming.
Sure.
Yeah, definitely. So we do a pre and a post test for our peer leaders coming into the program. We don't do it. We have some questions that are centered around life skills. We haven't analyzed it for predictive. For like their prediction on how well they'll do with the program. One of the things we say is a lot of times our young people are coming to us because it is a job. We stipend for the program, and so many of them don't even know what they're signing up for. They just know it's their first job. So we feel like it's our job to build life skills training into the program. So we do the content training, but there's plenty of other skills that we do. We do talk about sexual health. We do have a heavy focus on college readiness. We do have a focus on supporting them with school and tutors. So as part of our program, we're thinking about them as a whole young person and not just simply as, you know, a mouthpiece to do workshops in the community. I hope that answers your question.
Great. I think it did. That was excellent. And kind of reflecting back on the idea of you know, of this prediction as well as indicators, has there been any information or experience that you've had that shows that adolescent dating abuse and addressing that has had a likelihood of reducing any adult abusive relationship issues?
Is that a question for me, Nicole?
That could go to either one of you. I kind of am throwing these out to both of you since you work together so closely.
You know, I can jump in and say that we have the opposite. So we know that if you are in an unhealthy relationship, either as a victim or a perpetrator in adolescence, that's associated longitudinally with higher risk of unhealthy relationship in adulthood. I don't know that we've had the resources or we've been at it long enough to look longitudinally at whether if you do a better job of preventing, if that then is protective against or you're in a healthier relationship as an adult, but it's a really interesting question.
Mm-hmm.
Great. Let me go back to a couple clarification questions. Nicole, you shared a wonderful amount of information about the Start Strong program. Somebody had asked about whether you thought there were unique factors regarding the Boston larger community that have contributed to your success of Start Strong programs that other people might consider when they're looking at developing a similar program in their environment.
Yeah, definitely. I think we're fortunate enough to be in a city. When we were doing Start Strong nationally, there were other sites where, Idaho, for example, the resources weren't clustered in the same location. So I definitely think one of the things that is unique is that Boston is heavily resourced as far as the number of universities that are here, the number of community centers that we have, the number of other youth programs that we can then reach out to do workshops at. I definitely think, though, it can be replicated in other areas, especially if you really tap into the other resources that your community specifically has. And then also what we try to do is we try to weave ourselves into other programs. So we know that there are plenty of programs that do science, that they do math programs, and what we really feel is healthy relationships can either support or railroad a young person's direction in life. So we try to just work with those programs as well. So I think one suggestion would be is really think more broadly about the youth programs that you're doing and reaching out to, and then thinking about where you're gathering your youth from as well.
And so you were just discussing kind of tying into other programs and so forth. We had received some questions about funding and from some of the participants, for example, who have funding for substance abuse prevention only and other restrictions. What's been your experience in being able to braid together funding streams in order to be able to promote a comprehensive program like Start Strong?
Yeah, definitely. I think one of the things that would be tough but is doable is to really try to put the linkages together. So, for example, there's a curriculum, an evidence-based curriculum called the 4th R, the 4th R being relationships. And so they focus on explicitly like substance abuse prevention, bullying, and sexual health. And so I I think you can make the connections that healthy relationships and actually specifically teen dating violence and the trauma that can ensue from it is connected to substance abuse. And so you might not be able to do all of your program around this topic area, but you might be able to make the assessment that, you know, this could be a risk factor for a young person getting involved with with smoking marijuana or being introduced to drugs, and therefore we think it's important to do 20% of our workshops on this topic.
There's a tremendous amount of interest in the success of Start Strong. Are there any resources that you could direct people to, or a model of sort that they could utilize to be able to initiate a similar program in their own communities?
Definitely. So we have the Boston Public Health Commission, we have our website, www.bphc.org, and so you can go on there and look up all of our tools, our resources, and description of the program. But also, if you want to email me, I'm more than happy to discuss the details and maybe even send you what we do for our summer 6-week training. We've definitely shared that curriculum very broadly with other programs, so we can talk about what that first 6-week period looks like and how to get things off the ground.
Would you repeat that that website, and Rebecca, would you post that in the Q&A pod for participants to be able to see?
Yeah, so it's www.b as in boy, p as in public, hc.org.
Great. There were some other questions about this discussion of expanding from the concept of teen dating to adolescent dating. And one participant had asked about the fact that, romantic relationships are starting much earlier. Do you know of any efforts, either one of you, that are happening right now to address dating earlier, in elementary school and so forth, to help curb this issue?
I do know that, the Coaching Boys into Men program, which is a program that works with athletic coaches, is now expanded. They had done a randomized control trial and found that it was effective at high schools. The athletic coaches give messages to their team players. And they expanded that downwards to middle school, and they're in the middle of the randomized control trial for that now. So that's one thing, that's at least gone to middle school, and there's also been shifting boundaries as a sexual harassment and dating violence prevention curriculum that has also been tested in middle school. There's bullying prevention programs and social emotional learning promotion programs that have been tested and found to be effective in elementary schools and to be protective against the type of interpersonal aggression that we, might say is, whatever, has a romantic nature to it, or flirtation is at the root of the relationship or something like that. There isn't a dating abuse specific curriculum that I'm aware of that's designed for elementary school.
Okay. I have so many questions that are coming in. I'm trying to organize them, and I apologize to anyone if I'm unable to get to your question in the few minutes that we have left. I think I'll just sum up by just, again, inquiring about the best way that people could really tie into the resources. We've had a lot of questions about accessing more on the media literacy resources, getting more information specifically on the Breakups Summit presentation. Is that all available on the website that you shared, Nicole, or are there other places people should go?
It's mostly, the tools are on our website. The content for our Breakup Summit, that you would have to reach out directly to me, just because we've had 7 years in putting up each wave of workshops. But we've shared it broadly and widely. One of the good things about being a city Department of Health, they were not proprietary. So literally, if you just reach out, I'm more than happy to share the information more broadly. But the base start of like the tools that I shared and just general descriptions are all on the website.
Excellent. Well, thank you. As we are at the end of our time, I just want to, unfortunately, transition us to concluding. and thank both Emily and Nicole again for their very informative presentations. As we mentioned at the outset, this webinar has been recorded and it will be archived. We will send the link to the archived recording to everyone who is registered for the webinar. We're going to ask that you please take a moment at the end of the webinar to complete our short evaluation. We very much appreciate your feedback, and it will only take you a few minutes. It really helps us in improving these webinars and addressing the topics that are of most importance to you. Our next event will be on Wednesday, October 13th, and you will receive more information coming out soon about how to register for this event. Thank you very much, everyone, for joining us today, and have a lovely afternoon.